Okay, so here's the thing. Yeah, I understand this distinction between sign and symptom. It's a technical distinction. I could see. I believe they try to teach that to nurses or whatever, but it doesn't bear the weight that was tried to that was placed on it in this argument about depression. And so I went and demonstrated because I was sure that temperature or fever is called a symptom. So this distinction they teach maybe to keep nurses' heads clear on this concept, but then case by case sign or symptom, it's often hard to tell which is which. And if you go look up signs of cancer, Harvard EDU, you find signs and symptoms of cancer in one list because they don't want to have to say, well, this is officially that of, because it's in principle objective versus subjective. But if somebody tells you that their shin hurts, that's subjective, but actually you could brain scan and find out which nerves were firing pain signals. So they don't distinguish. And this was in the context specifically where it was trying to be used as a very apt technical gotcha, right? Snake is saying that clinical depression just means you told a doctor you were depressed and he said, okay, now it's clinical. Well, that's not true. Okay? And the argument was, yeah, because they just look at a bunch of subjective symptoms and so they end up with a subjective diagnosis that isn't real. Well, that's not true. So I searched signs of depression to see if there were any signs. And it's like I said, oh yeah, things like lethargy, especially with the elderly, evidently, could go. They're less likely to feel the symptom of, oh, I've been real sad. And they could go with aches and pains, having trouble sleeping, lethargy, and get a diagnosis of clinical depression based on those signs. So this distinction of symptom and sign was this bunch of bullshit. It was all in the service of, and so they're all symptoms, and symptoms are subjective. And by the way, it's not that easy of a distinction to determine in each and every case. And you'll see signs and symptoms used. Yeah, it's an important distinction for the people practicing medicine, and maybe in general, but it's not the general meaning of symptom outside of medicine, and it's not even how the word symptom is used in medicine when communicating with patients. Or for that matter, with each other. It's signs and symptoms. You don't have to get into this stupid distinction. It doesn't matter when you're trying to help people. It's for that, but it does help when you're trying to say, oh, you said you had clinical depression just to glorify yourself, because that's a very common thing to say, I have a clinical psychological issue. I have a clinical brain issue. I'm glorifying myself. Because he likes victim shaming. And you're taking part in that, Carmel. I hope you're happy.